Interested to hear your perspective on a hot topic that I think you're well equipped to address, and that's healthcare reform and its implications for marketing.
Yeah, it really is become a topic that I've heard a number of marketers as well as healthcare executives bring up, and we're somewhat trendy in this industry, so we'll hear everything from, under healthcare reform, once everybody's insured, what do you need marketers for? And, all the way to, gee, we really need to focus growth and make sure that we're, doing that appropriately and going back. So it's the pendulum swings from one side to the other in this industry. We're talking about the transformation of healthcare systems from the kind of organizations they are today, which even under large healthcare systems, operating companies, are still somewhat fragmented in their care delivery, to this idea of an accountable care organization where care is coordinated, where we have a price point that's much different than it is today, where we're focused on outcomes and we're focused on managing the health of a population over a period of time or episodes of care and all those sorts of things that go with it. Definition and structure of the health system itself changes, which means that our value proposition, the products we offer, the segments we target, the relationships we have are all different.
Where does the need for branding come in?
Yeah.
Does it become a unified brand or a less unified brand?
Right. I think that's a very important question. I think brand is going to be one of the big issues that we have to look at in this change, because brands, exist for a number of reasons. They're certainly there, as a major business asset, and they should serve to help organizations leverage themselves into markets and to do better. But brands have meaning on the consumer side. They help consumers make choices, and they sort of, cut through the clutter. They sort of attach in meaningful ways. Now, an accountable care organization and the idea of that may be something different in the future than what the way that I access care today. When you begin to think about the business model of accountable care, that it is this organized body of healthcare services, and along with the vehicles to contract and to manage risk across that, it seems to speak to more of a unified brand, right? If you're bringing multiple physician practices now into an integrated physician enterprise, it's part of the accountable care organization. How is all that branded? Do you just bring physicians in and then put your hospital brand or health system brand or accountable care organization brand on those practices, without the understanding that brand is much more than just the name? That brand is really the totality of experience and the value proposition and how that value proposition comes to life. And if I'm now experiencing completely different things at every entity that has your brand name attached to it, the brand, your brand equity starts to erode very, very fast. Really, marketing executives need to step up and be part of the discussion going forward. They bring the perspective of the market, the perspective of changing competitive dynamics, the perspective of consumers and customer groups, be those in-use consumers or the folks that influence how they get health care, such as physicians. They understand marketing strategy. They understand growth strategy. They should be able to identify and help define and map out strategies for how to pursue growth, how to change levers of profitability. All of these are key roles that marketers must play in this transformation.
Has enough change taken place that you really need to start anew and begin the planning process over?
I think it's going to run on parallel tracks, because you have an ongoing enterprise,
Sure.
right? And for healthcare systems, for at least another half of a decade, I think we're going to be living in both worlds. We're going to be living in the world of today, defined by the way we're incented today, by the way people shop today, by the way it's organized today. And then we are starting to piece together this transformative model that is probably going to take a good half decade for it to sort of evolve and even, you know, mature a little bit. Now, I think the bigger issue around promotion for marketers today, it has nothing to do with healthcare reform. It has everything to do with the way technology has transformed our ability to reach and communicate with customer groups, or to create communities, to have dialogues now. And you know, it's no longer just the one way we're promoting out to you. Now we need to engage you, and we need to be engaged with you in communications. So when we think about things like, you know, the internet, the social media technologies, the mobile media, the move to mobile media, and all of that, I think, has more to do with our thinking differently about promotion. And how that's done. Keeping it in perspective, if we're just simply out there promoting without having the whole strategy behind it, who are we targeting, and with what offer, and at what price point, and at what design level, and, you know, how do we continue to build that, then we are really wasting marketing dollars. Healthcare organizations have limited marketing dollars. They need to spend those on those areas that are going to have the best return on investment in terms of growth and profitability. And there are probably ways for them to look at outsourced solutions as a way to you know, manage and keep things going. So I think we'll see a little bit of both. I've seen with some marketing organizations in healthcare that they've been able to stay much more contemporary in the technology and not fall behind when they partner with an outsourced company whose primary goal is to stay on the leading edge.
Sure.
And it keeps that marketing organization also leading edge. It's an exciting time in healthcare. You know, the healthcare as an industry undergoes these major structural transformations about every 10 to 13 years, usually as a result of some sort of outside influence. And this time, certainly, healthcare reform has been the driver behind what we're going to see. So the next 5 to 10 years will be an exciting journey. I'm looking forward to it.